So if we're doing any type of joint mobilization, again, same thing. Range 1 and 2 are more for pain and increased blood flow, increased nutrient exchange, making it feel better. You know, we can do those in lots of situations. Grade 3 and 4 are more for getting more mobility. We obviously are watching out for any type of hypermobility injury, like a whiplash injury that just happened last week. We're probably not working aggressively with joint moves, at least grade 3 and 4, right? I'm trying to think, there is a, I forgot the name of the special test. Vertebral artery test. Remember that? So the vertebral artery test was one where we hung off the edge of the table and kind of side bend, extended. We're looking for nystagmus and things of that nature. Again, if they have vertebral artery occlusion, right, we're not going to do aggressive manipulations, all right, mobilizations. Obviously, the therapist would write that. If I had something like that, like I said, I would be very clear. It would be very obvious, at least in my case. And again, when we do any type of mobilization, but really when we do any treatment, we're not looking for increased radicular symptoms. So if I'm pushing, and you're like, wow, my fingers are going numb, that's a what? A sign of peripheralization. Peripheralization is something we're looking for or not looking for? Not looking for, right? So if I'm doing that, then I'm not going to continue, right? I'm just going to maybe switch my technique. It doesn't. I might have him poorly positioned. I'm not saying immediately stop and never try again. It might be, hey, reposition, change your force, move up or down. But again, it's not continuing the same thing. Like, oh, this must be what we're looking for. Okay. So that's the concepts. All right. There is grade 5 high velocity thrust. Again, high velocity thrust is something certainly well beyond the scope of this class. All right. Again, therapists do high velocity thrust. That is definitely a postgraduate type of certification that you would go to. So again, you're not saying I'm going to pop your neck and give them a high velocity thrust. Doesn't mean you're not going to get a little mobilization. It doesn't mean a pop's not going to happen. It's not necessarily your intended target. All right. So if we're doing flexion, we are pushing in on. So the first two, the extension and flexion, we're pushing in a right on the spinous process. All right. I'm not going to bring it down there. You're fine. So bring this underneath you a little bit more, like that. You're good there. Perfect. We are going to work flexion first. Yes. Yeah. Working flexion. So if we're working flexion, our finger is on the spinous process that we're trying to mobilize, and we're moving it. Remember, it's at a 45, so we're moving it caudally in the anterior. I'm sorry, cephalic, so headwise. All right, in the anterior. So we're moving it in this direction. So my thumbs have to be in the right angle. So in this case, I'm going to be standing beside him. Again, we use thumbs. Sometimes we use 2 thumbs. You'll maybe see somebody use the palm of their hand, but 2 thumbs in pressure. And again, my motion is going to be that. All right. So I'm just in this position. I usually take a thumb and put it on top of a thumb, and I'm pressing. All right. So I'm just in this position. And then all I'm doing, we'll find my spot here. That's 2. Let's come down 3, 4, 5. So I'm on 5 for no real reason, just because I just didn't want to do it on C2 way too high. And then, and I'm just pushing forward and toward his head. All right. That assists flexion. The opposite of that is extension. In this case, I need to be on the one below, right? And I'm pushing posterior, down, so I'm going to be in this position. I'm pushing down and back, okay? So the direction of the book is caudal and posterior, right? So I'm kind of here, right? I'm on the one right below, and I'm pushing still in this angle, but I'm pushing on the bottom one. So I'm not pushing on the top this direction, I'm pushing on the bottom like that, okay? So I'm trying to get this one to slide this way as opposed to this one sliding that way. Understand what I got going on? I got 2 sitting like this. If I'm wanting flexion to happen, I want that to happen. If I want the extension to happen, I want that to happen. So this one's a pulling down, right? So it depends on if you're on the top one or the bottom one. Understand that? So top one, pushing forward. If I push forward, I'm flexing. Bottom, if I pull down and back, I'm extending. Clear enough? So 1 or 2, 3 or 4, doesn't matter which one you're at, okay? So I'm more in this case Again, same thing, so I'm in this position because I'm pushing in that direction, right? I'm gonna hook my finger on it, and then again, I'm pushing like that. You should almost be able to simulate their head wanting to do that, especially if you're pushing a little bit harder, right? Because you're helping extension there, all right? If you're gonna do side bending, or I'm sorry, let's do rotation, you have to get off the spinous process. If I'm on the spinous process, it's helping flexion extension. I'm gonna have to get on the transverse process to help rotation here, okay? So it's still a two-thumb technique, right? We're on the transverse part, you're on the side toward the restriction. So if he can't rotate to the left, I'm gonna be on that left side. And it's the exact same mobilization as the helping flexion. It's gonna be anterior and up, but I'm just on the transverse process, all right? And that's gonna help rotation. So, I find my spinous process, go right out to the side. Again, I'm gonna have a two-thumb hold. I usually put one thumb right on the other. And again, I'm on the side again because my motion is this. I'm just not right in the center. So I'm just pushing like so, all right? Again, work on grading different things. I'm showing you grade probably 3 because I'm pushing so you can kind of see that I'm pushing. But work on a grade 1, work on a grade 2, work on a grade 3.
So pushing on the right side to help with left rotation?
Yes, if you push on this side, it's going to help opposite rotation. Yep. And now roll to your back. Last one. Side bending's a little interesting. You use basically your hand as kind of the fulcrum. So you're taking, the book describes you, and all of these, by the way, pictures and diagrams are in the book. Again, you're not supposed to be proficient in this. I wade into this personally even so. I've never gone to continuing education on this, so I wade into this low, especially kind of from a neck perspective. This is a little bit deeper stuff. I would expect you to be able to do a posterior glide of the glenohumeral joint. I really wouldn't expect you to do posterior and anterior rotational modes of the cervical spine, certainly as an entry-level PTA. We're covering it, so we have a little concept of what we're going on. Again, if you get into a clinic that is 100% spine, they're going to do some mobilizations. You're going to talk to your therapist and say, hey, I need to be caught up to speed on this. You're going to look for some continuing education courses, especially if they're heavy into manual. If every patient you're seeing, you're doing some sort of manual with, you're going to seek out some continuing education courses. If you remember right, there's that Mulligan course, there's Oldsby, there's Caitlin Bourne, there's Maitland. All of those are big, handsy, manual mobilization people out there. You're going to look for a course like that suits your needs and go from there, okay? So on this side bending, they say you're going to passively flex and contralateral side bend. So if I'm helping, so if he can't go to this direction, so if he can't left side bend, I'm going to take his head, lift it up, and bring it across. Then basically my mobilization is going to come in kind of with my hand. And all I'm going to do is basically mobilize him over my hand, right? So I'm working on rotation or side bending by kind of doing that, right? I'm kind of mobilizing him into side bending. So that's a pretty effective mobilization technique. Probably definitely easier than rotation. Probably the two that are easiest are that and then just a regular anterior one, which helps our extension, okay? So let's kind of try those 4. Again, probably going to be different than the shoulder. You're going to feel not so comfortable with it. Again, I'm not expecting you to feel